Good morning. Today is Saturday, April 17th, 2021. This is our regular yoga therapy class through Sattvic Space. We have been doing this class for a long time, but for this pandemic time, we are now all for a long time, but for this, just want to be sure everything is working. So, pandemic time, we've been doing all through online, and we're presenting different concepts of yoga therapy, and today is another and a concept of yoga therapy which is very experiential. What does it mean? As you all know, yoga is a philosophy, because yoga is a union of your body, mind and spirit. Body is a hardware, mind is a software, spirit is a programmer. The practice of yoga fixes our software, our mind, so the hardware gets fixed. It is also very experiential, so it becomes a philosophy. The philosophy is called Yoga Sutra of Patanjali, 196 sutras, of which 193 is to control your mind. The practice is called Patanjali Ashtanga Yoga, 8 limbs of the yoga. We memorize this by heart: yam, niyam, yam social restraint, niyam personal restraint. Asana, the alignments, internal and external alignment. Pranayama, the voluntary regulated breathing. Pratyahara, control of your senses. Dharan is the focus. Dhyan is the meditation. Samadhi is the union of your body, mind and spirit. So essentially what happens, just 1 second, I need to check. Okay. So essentially what happens, that a practice of yoga causes we call it a treatment of a disease called rogi chikitsa, and a maintenance of the health. And this maintenance of the health and treatment of the disease, you are very much experiential. You can experience it, you can feel it, and you can literally look inside yourself for introspection. So what yogis have noticed, that corresponding to your body, mind and spirit, we have the 3 bodies. It's called a gross body. For the mind, it's called a subtle body. And for the spirit, it's called a causal body. It's a body of your past life karmas. It's to remove your ignorance and sorrows. For the subtle body, you use your breath as your main therapeutic tool. You inhale positive emotion and exhale negative emotions. Physical body, you ward off all the pathogens and you bring the balance between all the doshas and bringing your body back to homeostasis. We have the 5 layers are called koshas. Our body is called Annamaya kosha, or a food sheath. Around the food sheath, We have a pranamaya kosha of breath. That is a physiological function of the body. Physical body is our anatomy. Beyond that, the layer is called a manomaya kosha, is a mind. Mind is the contents of your five senses. When you put the five senses together, that's your mind. When those contents get processed, it becomes your intellect or buddhi. That is called your Viganomaya kosha or intellectual shit. When all the intellect gets processed, it becomes your wisdom, which is called buddhi, which is called Gyan, buddhi, which is your Anandamaya kosha. On the same context also, this is actually yogic anatomy and physiology. The yogis felt suddenly when they have a experiential practice, they feel there is an energy which was dormant into the root of the spine and started crippling up along the spine, which is almost feel like a snake crawling along the spine, and they gave the name, it's called the Kundalini Jagaran. Kundalini Jagaran was awakening of your chakras. So what was the concept of chakras? Chakras were when the yogis in a deep level of consciousness felt that they have seen the colors in front of their closed eyes. Those colors were colors of your rainbow, and the colors of the rainbows they assigned along the line of the spine, from top to the bottom: violet, indigo, blue, green, yellow, orange, red. Just give me excuse one time. I see some problem here. Okay. So there are 7 chakras. From the root is called the root chakra, Muladhara chakra. Between the navel area and the root of the spine is called your pelvic chakra, Shadhissan chakra. And the belly button area is called your solar plexus chakra, or called your Manipur chakra. Chakra around your heart is called your heart chakra, called Anahata chakra. Its color is green. Around the throat is called a throat chakra. Vishuddha chakra, color is blue, 16 petals. And these chakras have all has a physical appearance. They have a function. And between the eyebrows is your Agga chakra, or the 6th chakra, connected to your endocrine system. And in the top of your head is called your Sahasra chakra, crown chakra, 1000 petals. In a yogic concept, these chakras are a potential site for a energy which is also regarded as a spiritual energy, but they're in an imbalance and they're in a dormant. So you have a practice what is called a chakra awakening meditation. We balance this chakra with the asana, pranayama, mudras, bandhas, and I did a lot of session on the 3 bodies, 5 koshas, 7 chakras and how to balance them. And based on the concept of the chakras, the next your esoteric practice is called 3 bandhas. Bandhas are called locks, spiritual locks. The Sanskrit word is also called a granthi. Granthi basically is a tie, it's a knot. So these practices are extremely therapeutic. We have noticed, and actually I have noticed personally myself, I have seen the tremendous effect of your activating or engaging these bandhas. When you live with the yogis who maintains the yogic lifestyle, you will never see a yogi or yogini living home without practicing the bandhas. Very, very important. So what is the concept? The concept is there are 3 bandhas. There are also the bandhas in the hand, in the feet, but main 3 bandhas are called, first is called a Mula Bandh, root lock. Second is your abdomen area. Mula Bandh is in your pelvic area at the level of your pelvic floor, at the level of your abdomen, called Uddiyani Bandh, abdominal lock. And the third one at the level of your throat, which is called your Jalandhar Bandha or a chin lock. Activation of the locks, when you do the root lock, it comes in a sequence: root lock, abdominal lock and a chin lock, and you can do all the 3 locks together, which is called a great lock or Mahabandh. So what happens when you are practicing the root lock, Mula Bandh, we'll do the practice soon, the energy which is all locked, and especially the energy what you talk about in yogic term, this is the prana. Prana is a subtle energy which keeps us awake, alert and alive. The prana or that energy or the shakti moves from your chakras, from the Muladhara chakra, root chakra, to your pelvic chakra, then moves up to your solar plexus chakra, Manipur chakra. In a Manipur chakra, which is close to your belly button, when you engage yourself or practice the abdominal lock, the Uddiyani Bandh, that energy of prana moves from your solar plexus chakra, which is the Manipur chakra, next to your heart chakra. That is called Anahata chakra, then moves to your throat chakra. At the level of throat chakra, when you practice the chin lock, that energy moves up from your throat chakra to your third eye chakra called Agga chakra, and from Agga chakra to your crown chakra, Sahasra chakra. So essentially engaging those three bandhas, it is the ascending of the pranic energy from the root chakra to the Sahasrara chakra. And in yogic term, this is called the Kundalini Jagaran. Kundalini means it's a serpentine energy. It is regarded as a snake, and Jagaran means awakening. A color of the root chakra is red. Color of the pelvic chakra is orange, and color of your solar plexus chakra is yellow. In a spiritual practice, we see the spiritual leader puts a red dots in their forehead, which is your Agga chakra 6, and also they will put a red on the top. This is your Sahasrara chakra. The color migrated with the energy. They will also put a little bit of orange and yellow. They put it all around here. And also they put many times white. I've seen a lot of times white, and white basically is the summation of all the 7 colors: violet, indigo, blue, green, yellow, orange, red. So in a typical practice of the mudras, typical of the bandhas, you will see they will also practice bandhas with doing asanas, doing pranayamas, doing mudras. See, remember, asana, pranayama and meditation. These are the 3 components we use primarily. We pick and choose, and we use primarily for our yoga therapy practices. Then you incorporate mudras, bandhas, kriyas, so that you are able to incorporate the therapeutic power or therapeutic tools along with your practice. Now, say for example, you will see, we'll do Kapalbhati Pranayama. Kapalbhati Pranayama follows your Uddiyani Bandh, abdominal lock. Abdominal lock with the follow with your Agnisar Kriya. Agnisar Kriya is the totally sucking your stomach in and moving the abdominal wall to massage the intra-abdominal contents. We will do a chin lock, Jalandhar Bandha. We do a Jalandhar Bandha during our movement of our neck, which is called your Brahma Mudra. Then with the Jalandhar Bandha, we incorporate breath holding in inhalation, which is called Abhyantarin Kumbhak, which is called a Murcha Pranayama. We will be doing the root lock, contraction of the pelvic muscle, pulling it up. It's almost like we call a Kegel maneuver, which is very popular in our modern medicine. In a Kegel maneuver, you will be doing it, say, for urinary incontinence, uterine prolapse, all the pelvic floor functional problems, dysfunction, pelvic floor. It's a very big yogic practice. Now let's see, the practice will start. The way we do the practice of a regular asanas, what we do called the relaxation asanas, Sithilikaran asanas. Then we do a set of pranayama. We do generally the alternate nostril breathing. Actually, first pranayama we start, the lung has to be emptied out. You remove all the contents of the lung. You take a deep breath in and breathe out longer than breathing in. Exhalation longer than inhalation, and incorporate the bandhas. And I'll show it to you how to do it. Then you do Bastrika or a bellows, which is called bringing your prana, Pranapradhan Pranayama. Because you do that to bring the prana, so the bandha practice will move the prana from the lower chakras to the higher chakras. So we'll do little Bastrika Pranayama at the beginning. Kapalbhati Pranayama primarily is a Agni Pradhan Pranayama. It ignites your Agni. Anulom Vilom Pranayama is a Vayu Pradhan Pranayama. It balances both sides of the brain. Brahmri Pranayama, bumblebee breathing, controls your five senses and quiets down your mind through the vibration. Ujjayi Pranayama, constriction of the larynx to pulling it up. It's called resistive inhalation. It is an activation of your vagal tone. And you will see, we'll do all the practices. And finally, the chanting, and you'll see the chanting with activation of the bandhas. The first, once you are very relaxed, you are in relaxing asanas. This is called a Sukhasana. You put your feet underneath, then you cross your feet. This is another way activating both sides of the brain. Slowly, go step by step, you get into your Ardha Padmasana, or called Swastika Asana, and you stay in the asana for a long time, and it will do that essentially the neuroplasticity will set in, and you will be able to do other side. Always do both the sides. People want to do it right away. You are not going to practice asanas it is full form at the beginning. At the beginning, if you look for your pain, there is no pain, you stay here. If there is a pain, you back off. You put your feet here where there is no pain, and you have an effortless breathing. Don't push it down. The moment you push it down, it will come back higher. It will happen on its own. And essentially, when you are relaxed enough, you will be able to sit down, which is your lotus pose. So the asana to practice your activating your bandhas is the same as your therapeutic asana, which is called your Sthiram Sukham Asana. Sthiram is a stillness, Sukham is the happy, Asana is a grounding pose. Here I am in a grounding pose. I do not have any twitching. The twitching of the muscles loses your stillness. So I'm in a stillness, Sthiram. I'm Sukhi, means I'm happy in this pose. So I came to this pose in stages. I did not do it now, one day. It took some time. I was like a stick. I was very rigid. But the neuroplasticity sets in. I'm sitting down here, not that I'm sitting like here. My brain is allowing me to sit like this. with neuroplasticity. So in a Sthiram Sukham Asanam, you practice relaxation, powerful relaxation in the hand. It's called Balu Mushti Mudra or Adhi Mudra. Put thumb inside, close your hand, put it over your knees. Now we bring the Prana Pradhan Pranayama. How does you bring your prana within your body? Which is called your Bastrika Prayer. So all different ways you can do Bastrika Pranayama, but I will be telling you to do it. When you do it very slowly, Bastrika Pranayama, then effortlessly, you can start doing for about, say, 20 seconds, 30 seconds, 1 minute. Effortlessly, you will be able to do it for a long, long time. If you're practicing with me, you can raise your hand high up. Breathe out first, take a deep breath in, and breathe out, slowly put it down. So if you keep on doing it, remember the effortless practice is you'll be able to breathe, you'll be able to even talk. From there, you can do a little faster. Like let me show you to you initially how to do it, then you'll be able to do it longer and longer. See, I'm doing it as if this is my normal breath. That's why the prana will come in, and prana generally gets locked at certain place. So during your mudra is called your psychophysical connector. It's a connector between your body and mind which moves your prana to the organ of healing. And Bandha practices, it activates those prana. Very, very important concept. And initially it feels like it's an esoteric concept, but it will feel within your body and mind. Prana also you can direct through a meditative practice. When you close your eyes, when you follow your breath, guide through your breath, breath is the carrier of your prana. Prana is like an electricity and breath is like electric cable. So when you guide that prana through your breath, and remember in yoga whole body breathes, not only lung, it will go to the organ of healing. And just do a little bit more. Let me show it to you how to do a little more, little faster and longer Bastrika Pranayama to bring the prana within our body. I can continue longer and longer, but you do only up to that level when you are able to talk, able to sing, able to breathe completely effortlessly. This effortless practice of your voluntary regulated breathing is the therapeutic pranayama, and it is the therapeutic outcome of your all the bandhas. Bandhas have a tremendous therapeutic benefit. So once you can do that, you can also do very slowly and simply a Bastrika Pranayama like this. You can do It is an active inhalation and active exhalation. So when you practice it. At the end of the practice, now you cannot talk, you cannot breathe. That means you have crossed your limit, crossed your balance. Try one more time. This is a wonderful practice. The moment, remember, what keeps us alive? Prana. We are from Bengal, we call it a pran. Pran amaderke debe. Pran gives everything. We do not have the understanding of prana in our modern medicine. But we understand very clearly in the traditional system of healing. This is our prana. Try one more time. Bring prana in your body. You can do a little rapidly now. Rapidly with the shoulder movement, will you see what it does? It affects, makes your body supple. It is an emancipation. Your chain, your time is going away. I do morning jalneti. I do have some drainage which comes out. It's entirely normal. This is a wonderful practice called your Bastrika Pranayama. You can do a hand raise higher. You can do a very slow speed, at a medium speed, and a very rapid speed. You'll be doing medium speed. A rapid speed. You can like to count, but what happens in our regular yoga practices is that our body and mind is so connected, we really don't know how to even count. So now you have a prana within your body. You are in a sthiram sukhasanam. Now you have to engage the bandhas. The first prana is locked in your root lock. Or your chakra, root chakra, Muladhara chakra. Sit down in any asanas you want. You can use a Vajrasana, very relaxing. Sukhasana, Siddhasana, Padmasana. Have the hand in a relaxing in an Adhi Mudra. Breathe out first. Take a deep breath in. Completely breathe out. Contract your whole pelvic floor with your anal sphincter, anal canal sphincter tightens up and pull it up as high as possible, contracting your lower part of your abdomen. So basically you are pulling up all your levator muscles, and in an anal sphincter, this is called a puborectalis muscle which acts like a sphincter. You are pulling it up and you have to hold onto it. Let's try one more time. Breathe out first. Take a deep breath in. Completely breathe out. Pull your pelvic floor anal canal up. Wonderful practice for women. Women has a tremendous pelvic floor pathology. We call it a dysfunctional pelvic floor. And it happens because of their childbirth, because of the lack of pelvic floor support. So, very good for men with a prostate problem, men with or men and women with a urinary problem, and all the pelvic organs. Try it again. Same way you will see when I'm doing a Kapalbhati Pranayama, which we show in the Pranayama practice. If you're looking at me, Kapalbhati Pranayama, your abdomen goes in, the belly button goes in, it presses your abdomen, it presses your diaphragm, your chest, air comes up. Active exhalation without any inhalation. Very slow, one at a time. Now what you do, with every stroke putting it in, you will be contracting your anal sphincter and pelvic floor and pull it up at the same time. Very powerful practice. Mula Bandh with Kapalbhati Pranayama. Let me show it to you again. My spine is straight, eyes are closed. So every stroke I'm making, my anal sphincter, my pelvic floor is being pulled up. This is a synchronization. So let me show my hand. My hand is a pelvic floor. My hand is like anal sphincter, and look at the coordination between Kapalbhati Pranayama and my anal sphincter and pelvic floor. When it's up, my hand will go high up like this. It is moving your prana, the life energy, from your chakra, root chakra, Mooladhara chakra, to your pelvic chakra, Swadhisthana chakra. Pelvic chakra is connected to all reproductive issues or the female reproductive organ. It is a problem with your excuse me, uterus, tubes, ovaries. PCOD, PCOS is a big problem for the women. Polycystic ovarian disease or polycystic ovarian syndrome. It's a wonderful practice for the female diseases. After an Kapalbhati Pranayama, which you have done, you have seen, we do all the Kapalbhati Pranayama with all the mudras. Dhanu mudra or Gyanu mudra, Vayu mudra, controlling your vata, pain, Shunya mudra, improve your hearing, Prithvi mudra for grounding, good for diabetes, obesity, Varun mudra, It is controls your bladder. This is many a time you can do the Mula Bandh with a Varun Mudra. So when you do, this is called synergistic. You got to do a two, you get an effect of more. This is called your Shakti Mudra. Prana Mudra. This is your Prana Mudra. It brings your prana within your body. So you do a Kapalbhati Pranayama, the Prana Mudra, Apana Mudra, or it is called Pachun Mudra, Apana Vayu Mudra. But all the mudras, what you do, you sit down, do Kapalbhati Pranayama, what it does, it relaxes your abdominal wall, abdominal musculature. So now what you do, you go ahead, breathe out first, take a long deep breath in, completely breathe out, suck your stomach in and hold. So what it does, when you suck your stomach in and hold, it reduces the intra-abdominal pressure. Intra-abdominal pressure goes down, so there is a better perfusion of the abdominal organs. Think about, after our vital organs, every disease takes place here. Liver, kidney, spleen, stomach, large intestine, small intestine, everything happens here. Udar Karshan, massaging your abdomen. There's a word in Sanskrit, word in also called in Bengali, you say, pet naram, means when your abdomen is soft. Matha thanda, that means when your mind quiets down. Agitation of the mind goes away, called chitta vritti nirodha. Matha thanda, called maro daktar ko danda. Means, let the doctor get out of your house. You don't need a doctor in your house anymore. So, do a abdominal lock, Uddiyani Bandh. Breathe out first completely. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Hold as long as you can without any effort in your breathing. This is Uddiyani Bandh, abdominal lock. I practice daily. I will practice at least 3 to 5 times the abdominal lock and another 3 to 5 times called Agnisar Kriya. Agnisar Kriya I will show you next, which will be helping you massaging all the intra-abdominal contents. Now if you notice me, very, very important concept. I am in a relaxing state because of my Sthiram Sukhasanam. I am in a relaxing state because of my voluntary control of my breathing pranayama. When I am doing the root lock, Mula Bandh, you will see my abdominal go in. During Mula Bandh, automatically you will see it happens to your Uddiyani Bandh. Let me show it to you. I am breathing out first. Take a deep breath in. Completely breathe out. Contracting my anal sphincter, pulling it up. It happens automatically because you are in a very relaxed state. whole relaxation response, whole parasympathetic activation is the root or is the therapy for lifestyle related disorders. People have diabetes, hypertension, heart disease, arthritis, you can name it. The moment you can elicit your relaxation response, the moment you can do activation of your parasympathetic tone, a lot of them will do pumping and cupping, massage your ear, massage your carotid sinuses, we do all the practices. You are so relaxed, you can go back and forth, blood sugar will come down, blood pressure will come down, heart rate will come down. I have a lot of problem with both the knees. It makes a crackling noise when I go up and down, but with the relaxation I can sit down. This is not going to kill me. This is the pain, which is a nuisance, but I overcome this. And how do you know this happens? We have this monitor, health tracker. This is my Apple Watch. I'm watching all your health parameters here. Now we have another one called a small skin patch. You can measure your continuous blood sugar. And you can see what the blood sugar does with this practice. I will soon doing it. So once you do the abdominal lock, then you can move the abdomen, massage your abdominal content, which is called your Agnisar Kriya. Let me show it to you, the Agnisar Kriya. Again, you breathe out first. A deep breath in. Completely breathe out. Wonderful practice. The therapy for diabetes. Somebody has a diabetes. You don't do the asanas, you can sit down, do a Kapalbhati Pranayama, do the Anibandh and do abdominal Agnisar Kriya. I'll say money back guarantee. The blood sugar is bound to come down. So you will be able to see what it looks like. This is your abdomen. This abdominal wall is going to massage all of your intra-abdominal contents. Do one more time, so you'll be able to see and able to understand. Breathe out first. Take a deep breath in. I practice every single day, 3 to 5 times, abdominal lock, Uddiyani Bandh, 3 to 5 times, your Agnisar Kriya. By the time you do this, we say you never leave home without doing it. So because you see, remember, People are all stuck with the asana practice. Asana practice is a relaxing asana. It's called Arambha Sthiti Visarja. Arambha is the beginning. When the muscle contracts, then the muscle relax. Before relaxing, it called twitching. Twitching goes away, then you get a profound level of relaxation. This is in contrast to your exercise. Exercise is a muscle contraction. Yoga therapy is a muscle relaxation. Exercise is a sympathetic response. Yoga practice is a parasympathetic activation. Now you'll see, I will do Ujjayi Pranayama. Ujjayi Pranayama is constricting my larynx, trying to breathe it in. And if you're not knowing too much about the pranayamas, you can go ahead and take a look at my YouTube channel. I have lot of practices about pranayama, all the different pranayamas for different disease. Now I want to show it to you. When you do a Ujjayi Pranayama, automatically you will see you will have a abdominal lock. What a powerful practice is this. And this takes care of all the See, the biggest culprit for us today is called your truncal obesity. You know, generalized obesity, we used to think, oh, you know, this person is fat, this person is obese. Obesity has nothing to do with your real creation of your metabolic syndrome and lifestyle related disorder. It is all here. This is called your truncal obesity. We call it a bhuri. That fat is inside the abdomen. The fat is not underneath the skin. It's not underneath the skin. It's inside the abdomen. That fat creates all the inflammatory molecules, pro-inflammatory molecules. It creates diabetes, hypertension, heart disease, everything comes from here. So the moment you do this, you are doing a tremendous therapeutic help to our lifestyle related disorders. Lifestyle related disorder starts with a stress. Stress causes cortisol. Cortisol converts glucose into omental fat. Omental fat secretes pro-inflammatory molecule. It causes your diabetes, causes your hypertension, causes your blockage in the coronary arteries and all over called atherosclerosis, causes high cholesterol. These are all called a metabolic syndrome. And it's not the risk factors. Today you have a diabetes, tomorrow you will have a hypertension, day after tomorrow you will have a heart attack. Today you have a high cholesterol, tomorrow you will have a diabetes. Or the other day you will have a heart attack. Or today you have a heart attack, after next day you will have a diabetes. These are all interlinked. So these are the therapy. So let me show you the Ujjayi Pranayama, which activates your parasympathetic tone. It activates your vagus nerve. Breathe out first. Take a deep breath in. Completely breathe out. When you develop cough, the cough is entirely normal from your Ujjayi Pranayama, because you are constricting that larynx, constricting the vocal cord. So in fact, when you get the cough, we know your Ujjayi Pranayama is being very well activated. One more time, take a look at it. Breathe out first. Deep breath in. These are the practices. Generally you don't see any of the our regular yoga practices, yoga practitioner. This comes from your therapeutic outcome. Jalandhar Bandha, chin lock. When you slowly bring your chin towards your heart, you have the two organs on the side of the neck. It's called carotid sinus. The carotid sinus gets activated. When the carotid sinus gets activated, carotid sinus is supplied by your branchiopharyngeal, actually glossopharyngeal nerve, but it is also activation of the vagus nerve. So what it does, it quiets down your cardiovascular system, nervous system. It's a profound therapeutic benefit. In fact, if a heart rate starts going high up, it's called supraventricular tachycardia. We do the carotid sinus massage. We massage your carotid sinus. Also in a chin lock, what happens, there are two muscles called trapezius muscle and sternocleidomastoid muscle. Both the muscles are supplied by a cranial nerve called accessory nerve. When you do that, it also activates the cranial nerve and really quiets down your whole nervous system. Again, hands in Adhi Mudra. You don't bend your neck or the shoulder. Try to keep your neck straight. Breathe out first. Slowly take a deep breath in and drop your chin down and keep breathing. Exhalation longer than inhalation. Keep your chin down and this chin touches your chest and stay here. Now we have seen when you quiet down your cardiovascular system and nervous system in one practice, what kind of therapeutic benefit it causes. That's what we said. We don't leave home without practicing or engaging our bandhas. Then what you do, you breathe out first, take a deep breath in and hold your breath. It's called kumbhak. In Sanskrit, breathing in, inhalation is called purak. Breath holding is called kumbhak. Breath holding in inhalation is called abhantarin kumbhak. Breathing out is an exhalation or called rechak, and breathing and breath holding and exhalation is called suspension in English and in Sanskrit called your Bajra Kumbhak. When you hold your breath, the lung starts to expand because lungs is like a balloon and the air is not coming out. It activates and slowly when the lung starts to expand, it cannot expand anymore because of our thoracic cage. Then at the surface of the lung, there is a fiber of the nerve called vagus nerve. The vagus nerve gets activated and it is called a herring-brewer reflex. In herring-brewer reflex now, it will start compressing your lungs so the lung cannot expand anymore. It activates your vagal tone, parasympathetic activation. It is such a powerful relaxing experience that this is called a Murcha Pranayama. Murcha means almost unconscious. So wonderful practice before you go to sleep. If you have insomnia, you do Murcha Pranayama. I have so many interesting stories to tell you. There's a person from here, his colleague talking to his friend, he lives in Bombay, Mumbai, in India. He's saying, what you're doing? Then I'm practicing Murcha Pranayama before I go to bed. And he's actually a friend of mine here in US. He said, what is a Murcha Pranayama? He said, I don't know. We learned it from your friend. He taught us. So let's take a look at it again. I do everything in Adi Mudra because Adi Mudra is relaxing. That's where the baby closes the hand. When I do practice, I'm like a baby, competing with baby. Breathe out first. Take a deep breath in. Hold your breath. And slowly drop your chin down, touch it to your chest and keep counting. Just count like a 1 and 2 and a 3. Wonderful practice. Now you'll see it is such a relaxation practice that I'm doing a Ujjayi Pranayama. When you constrict your larynx, it activates superior and inferior laryngeal nerve, which are branch of the vagus nerve. It will activate my abdominal lock, Uddiyani Bandh, which will cause increase in my negative intra-abdominal pressure, so there will be better function, better perfusion of the organs. Then I will incorporate a chin lock, Jalandhar Bandha, and then following that I will do a left nostril breathing. Left nostril breathing is called your Chandranari, moon energy, that is also parasympathetic. Just do a practice and you'll see how wonderful practice is this. By the time you'll be able to do this, able to sit down in this called your lotus pose. See how long I'm sitting in the lotus pose. Nothing is bothering me because also look at that, I have some saliva in my mouth. Saliva in your mouth. I've been talking to you over an hour. I didn't drink anything. Saliva is activation of parasympathetic tongue. When you get scared, when you have sympathetic activity, you get a dry mouth. And here you get your wet mouth. Ujjayi Pranayama, Uddiyani Bandh, abdominal lock, chin lock, and the left nostril breathing is called Chandravedi Pranayama. Breathe out first. Take a deep breath in. Completely breathe out. After that, you do the pumping and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove the glasses. Take the hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand. Keep your hand until all the heat is come to the eyes. It relaxes your eyes, the ciliary muscles. Massage your forehead. All the muscles in the forehead is attached to the skin. The muscles are relaxed. All the skin markings are gone. All the vertical lines, all the lines are gone. The face all the face, all the furrows goes away. Massage back of your ear, front of your ear, inside the ear canal. It's activation of the auricular branch of vagus nerve. Massage your carotid sinuses. Massage in the back, the trapezius muscle insertion, sternomastoid muscle insertion activates accessory nerve. Can't have a better practice than this, and when you do it daily, I can also guarantee you, no chronic diseases, no lifestyle related disorder will come to you. We have an excellent modern medicine to take care of our acute problems. Have acute coronary event, have a heart attack, I get a balloon angioplasty right away, bypass, name it. We have medication, procedures. I have a cancer of the breast, you can take care of me. Cancer of colon, you take care. We have autoaxin. But the chronic lifestyle related disorders, simply chronic back pain, migraine, headache, diabetes, hypertension, heart disease. So, we'll end with a final practice, what is called your great lock, Mahabandh. In a Mahabandh, you see the effects and benefit of every locks which I talked to you, starting from your pelvic floor, pulling it up. It helps massaging all the pelvic floor, improve your pelvic floor dysfunction, good for pelvic organs. Abdominal lock, it increases your negative intra-abdominal pressure, good for whole functioning. Agnisar Kriya massages all the intra-abdominal organs. Chin lock, it activates your carotid sinuses, all the combination, Ujjayi Pranayama, chin lock, and your Chandravedi Pranayama, left nostril breathing. You will engage one bandhas at a time. So the root lock, abdominal lock, chin lock, and hold it. And the releasing is chin lock first, abdominal lock, then a root lock. Breathe out first. Deep breath in. Completely breathe out. Root lock first, followed by abdominal lock, followed by chin lock. Wow. By the time you take great lock, you have a wonderful, wonderful practice. Please keep practicing. I give you enough tools to practice. You will do daily asana practice, pranayama practice, but don't leave home without activating your bandhas. You will go for a yearly checkup. You go for a yearly checkup to your physicians. Your physicians will only say one thing: I don't know what you are doing. What you are doing it right. Please keep on doing it. We are called integrative physician. We integrate our traditional system of healing with a modern medicine. We go for a regular checkup. We do everything. If my blood pressure is high, I take the blood pressure medication. But I continue a practice of yoga, my blood pressure starts to come down. My physicians are scientific physicians. They'll start reducing your dosage at a certain point above medication. I had open heart surgery 20 years back. 15 years I have not touched a single medication. I'm free of any medication. I'm free of any diseases. But instead of it, I do it every single day practice. I maintain a yogic lifestyle. Thank you again for your participation. It's a wonderful time. I always have a good time with you on Saturdays. I will come back again with different topics. If you have any questions, please put it in the comments. I'll be glad to answer for you. Even the comments, if you get the comments, please do it. And as long as I'm in town, hopefully see you again next Saturday. Unless I'm really compelled and I'm tied up during traveling of this time. Otherwise, I will also present to you via this online now to anywhere I am. Okay? See you next Saturday. Actually, next Saturday I have a yoga teachers training. So I may not be able to come next Saturday, maybe 2 weeks from now, I'll see.